The Sanford PLEDGE Study is reaching a new milestone around 4 years after it was launched. The study is a broad effort to screen children and identify those who may be at risk of developing type 1 diabetes and celiac disease. 4 years later, 10,000 patients have been screened. Screenings can and have been done for children with a genetic history of type 1 diabetes, but that isn't good enough to catch a majority of the cases.
But by focusing there, you're missing 90% of the people who are actually going to get type 1 diabetes.
Dr. Kurt Griffin is the PLEDGE Study's principal investigator. Thanks to grant funding from the Helmsley Charitable Trust, Sanford Health is able to offer the screening at a wide number of clinics. Griffin says that allows them to cast a broad net.
If we're going to find them and be able to catch them and intervene before they get sick, that's our goal, we have to look more broadly. And we can't do that in our usual research way.
Out of the 10,000 screenings, more than 70 children were found with autoantibodies, indicating that they were at risk for developing type 1 diabetes. If left untreated, diabetic ketoacidosis can set in, which is a life-threatening condition. Griffin says their findings have helped families start down the path to monitoring their child's condition and treat the disease, even though the screenings are still part of the research project.
We don't just want to tell the families, okay, here you are, thank you. What we want to do is say, all right, now that we're aware of this is where we can keep an eye on things and have periodic visits.
And it's that standard care that he wants this screening to eventually fall under, that this is something children are checked for just like any other screening they get.
We're at a point where it's time to look at how do we move this into standard care and not make this part of a research project that we're doing at Sanford, but eventually just have it be part of something that all kids get screened for.